A very warm welcome to all of you here today, and thank you for coming to this session on SafePani. My name is Claudia Neuschulz. I work for the European Bank for Reconstruction and Development on delivery of water sector investments, and I'm delighted to be here today to moderate this session for you over the next hour and 15 minutes. We're going to discuss the SafePani model today, which proposes a reform in institutional design, sustainable finance, and information systems on how to deliver SDG 6.1 on universal access of safe water in health centers and schools. This session will feature the collaborative work under the SafePani model and will discuss plans to formalize this model at district level. I would like to introduce to you the speakers for today. I would like to welcome and introduce you to Mr. Muhammad Ibrahim, Secretary in the Local Government Division of the Ministry of Local Government, Rural Development and Cooperatives. We are also joined today by Mr. Khairul Islam, Additional Secretary of the Local Government Division, as well as Mr. Kamal Hossein, Joint Secretary in the Policy Support Branch and of the Local Government Division as well. And here on the right-hand side, you see also Mr. Nurul Osman, who's the Managing Director of Husawa, who will present part of the model to you today. And to my left here, Professor Rob Hope and Katrina Charles from the University of Oxford, who will give you an introduction into the challenges in the water sector in Bangladesh. So the overview of the next hour, we'll first have a presentation on the challenges of the delivery of safe drinking water services in Bangladesh to give you a broad overview on the situation in the country. We'll then have a keynote by Mr. Muhammad Ibrahim on water governance in Bangladesh. And we'll then move on to presenting the details of the SafePani model in its design, the results, as well as the next steps. By the end of that presentation, we'll hopefully have enough time for some questions that we will take, and then close with some reflections by 1:45, hopefully, so we can leave this room on time. So thank you, everyone, and I would now like to hand over to Rob to present the first part of the session.
Okay, well, good morning, everybody. Thank you so much for joining us here today and those online as well. I'm just going to say a couple of brief words of sort of regional context of what the issues that we're looking at from both a climate risk and a water security perspective. We've got a couple of very pretty maps in front of you there that you can get a sense of the geography of Bangladesh. So for those unfamiliar with the country, it's located at the foothills of the Himalaya. The three great rivers, the Ganges, Brahmaputra, Meghna, flow down through the country. Around 93% of the flow flows through Bangladesh. You also have issues in the Bay of Bengal of cyclones, and there is sort of damage and risks associated with this on a periodic basis. And water quality concerns both above ground and below ground, which Katrina will talk to you about in a moment. But it's certainly a country that faces a lot of challenges. It's overcome a lot of those. It's a very young and dynamic country in my view. I mean, it's young politically, winning independence in 1971. It's also young geologically. Some of the challenges it faces from the groundwater side are due to the sedimentary load that comes due between 0.5 and 2 million tons of sediment will flow through the country. And that's also one of the reasons that you have these pockets of arsenic located in different parts of the country as well. It's very dynamic. As a country, my experience of working there, you can sort of see the entrepreneurial spirit within the country, the major progress it's made since 1971 across many, many development indicators, which puts it in a strong position going forward. I'm going to hand over to Katrina, who will talk a bit more to the water quality issues. Oh, hang on, sorry, I won't. I will say one word on the program of our work. So the collaboration that we have with the government is being under the UK FCDO REACH program. So this is a long-term program of research that started in 2015 to improve water security for 10 million poor people in Africa and Asia by 2024. We describe it as a science practitioner partnership in terms of we're trying to co-develop, collaborate in terms of what are the most significant but uncertain issues in the countries that we work in, including Bangladesh. In this context, we work in the coastal region, and here we've been focusing primarily on safe drinking water services in schools. It's something that has increased in prominence. There's more reporting and understanding of the challenges and gaps in this system. And Bangladesh has a long history of engagement with SDG 6 at the very highest level. And it's something that we've been able to develop this program of work called SafePani that you'll hear more of today.
Thanks, Rob. So Rob's highlighted some of the water quality challenges. One of the things that Bangladesh has achieved is to have almost universal access to improved water sources. So they've got 99% of the population having access. But there remains a big challenge in terms of drinking water quality. So the graph on the right is from the last mix water quality survey. So highlighting that 60% of sources at the point of collection were free from fecal contamination, but 40% still experienced fecal contamination. And that contamination is likely higher in the monsoon, so we know that it's seasonal as well. There are seasonal challenges. Additionally, the area we're working, which is the coastal zone of Bangladesh, there are multiple water safety threats. Rob has already highlighted the arsenic challenges that are faced in Bangladesh, and many of you will be familiar with them already. They're very well discussed. So there are the geogenic water quality threats from that. But there are also other geogenic water quality threats, so manganese as well as iron are some of the other things that, the other challenges that are faced. In the coastal zone, there's complex hydrogeology, which means deep freshwater sources aren't readily available, so deep boreholes aren't necessarily an easy fix to this problem. And there's also increasing salinity challenges in the area. Rob highlighted the challenges of cyclones and some of the other climate threats. And so this is an area where there is issues around flooding and inundation associated with cyclones and storm surges, which adds another layer of complexity in terms of providing safe and reliable access to safe and reliable water sources. So this creates a complex challenge then to deliver water quality in this region, to deliver that safe drinking water quality. It may not be that dissimilar to some of the other challenges that you'll face in the countries where you're working, because there are often many threats that we face in delivering safe drinking water quality. Before we give you more details of how SafePani is addressing this in the model, it's my pleasure to introduce Mr. Khairul Islam, the Additional Secretary of the Local Government Division, who's going to share more on the context of the governance of water in Bangladesh.
Thank you, Professor Katrina. Distinguished participants, welcome to the presentation of Local Government Division, Ministry of Local Government, Rural Developments and Cooperatives, People's Republic of Bangladesh Government. This is MD Khairul Islam. Already Katrina has said, I am working with Local Government Division and looking after the water supply wing. I am also head of the water supply wing. We are 3 senior officials here from the ministry to share our water action and commitments. Our Honorable Secretary, Mr. Muhammad Ibrahim, is present here, and he will deliver keynote speech and also Bangladesh commitments and actions to achieve SDG 6. Mr. Kamal Hussain, Joint Secretary, is also present here. He was leading the policy support branch of Local Government Division. Let me share water governance system in Bangladesh. There are 2 ministries deal with the water. Local Government Division is responsible for safe drinking water supply, safely management, sanitation, hygiene promotion, and waste management. And Ministry of Water Resources is responsible for rivers, flood control, irrigation, embankment, and barrages. Let me now share the structure of local government division, Ministry of Local Government, Rural Development and Cooperatives that deal with drinking water. Our minister is led by the ministry, and secretary is the administrative head of the ministry. We have a water wing that deal with all drinking water related program and sewerage system development. Within the wing, we have a policy support branch that developed different strategy, policies, action plan, and guideline, etc. For rural areas and small towns, we have Department of Public Health Engineering. For large cities, we have Water and Sewerage Authority, WASA. Local government institution, LGI, NGOs are also work for safe drinking water service. Government of Bangladesh is working with a specific agenda to achieve SDG 6. Our policy support branch has developed necessary policy, strategy, and guidelines. Different knowledge groups are active. For example, local consultative groups, thematic group is working on this sector. Our national budget on WASH sector has increased from USD 0.56 billion to 1.18 billion. Let me now talk about how Government of Bangladesh collaborate with SafePani. We officially collaborate with Oxford University since 2021 to pilot SafePani model. Main focus of this model is to ensure safe drinking water in schools and health centers. We have National Steering Committee headed by Additional Secretary, Local Government Division, Water Wing, or relevant government departments are members of this committee. We also have a district working group headed by district administration and participated by all local government departments. With this few words, I would like to conclude my presentation here. Now I would like to introduce and welcome our Honorable Secretary of the Local Government Division, Mr. Muhammad Ibrahim, to deliver his keynote speech related to this side event. Dear audience, Mr. Muhammad Ibrahim.
Thank you, Mr. Khairul Islam, and good afternoon to everyone joining us here at the UN headquarters in New York, and all those who are able to join us remotely. Welcome. It is a pleasure to talk to you about the work of the government of Bangladesh to improve water security in one of the most challenging environments globally. As Secretary of Local Government Division, my responsibilities are wide-ranging in delivering rural connectivity, urban primary healthcare, and many other services to over 160 million people living in Bangladesh. This includes safe drinking water services for our cities, towns, villages, health centers, and schools. Prime Minister of Bangladesh, Sheikh Hasina, has provided national and global leadership in promoting SDG 6. The Prime Minister served as a distinguished panel member with 10 other sitting heads of state or government for 2 years in advance of this UN conference on water. The Prime Minister's commitment to a world where everybody would have equal rights and access to safe water has driven the work of multiple agencies in the government of Bangladesh for many years. Bangladesh met the MDG goal of improved drinking water access in 2015, reflecting these commitments and significant investments. We are working towards delivery of SDG 6.1 by 2030, and SafePani is one example of this work. SafePani reflects the SDG commitment to safe drinking water with a focus on health centers and schools. While we have focused on ensuring drinking water access, the quality of services may vary by context. Some schools face extremely challenging issues. The quality and availability of good quality water may be limited. This particularly applies in the coastal zone, where high levels of salinity are a major challenge. We know arsenic is a major threat in several areas of the country too. SafePani has defined clear roles and responsibilities to ensure every school has same level of service. No one is excluded. Our recent policy reform provides the basis to introduce professional service delivery models to allocate responsibilities for managing and monitoring safe drinking water at scale. This helps schools concentrate on education outcomes and not fixing broken water pipes. We will shortly hear of the pilot phase results, which are encouraging. The pilot phase was guided by the SafePani National Steering Committee, which I chaired. The committee brought together all relevant government departments at national and district levels to ensure a shared and effective platform for decision making. The University of Oxford supported the design and monitoring of the work in collaboration with UNICEF and ICDDRB. Haishawa was contracted to deliver the pilot study to over 200 schools and health centers. Quarterly results were reviewed and prompt actions were taken. The pilot phase will conclude in December this year. We plan to launch a government-supported contracted model for all 2,000 health centers and schools in Khulna district in January 2024. This will transition the work from a pilot study to a government program. If successful, this will provide a framework to be considered in other 63 districts of the country. Several challenges remain. First, securing long-term finance. Our goal is to ensure SafePani is funded to 2030 in Khulna district as a priority. We are planning a results-based contracting model where the government will blend internal funds with an external donor pool. Payments will be paid after quarterly delivery of results to reduce investment risks and increase transparency. Second, plans to achieve national coverage by 2030 will require action today. For example, Bangladesh has 150,000 schools with 40 million students. Results-based contract is one approach to help improve efficiency and sustainability. The government is investing in new water quality laboratories in every district by this year. Third, contracting service providers will require training and capacity development to transition from building infrastructure to maintaining safe drinking water services. This will take time and resources. Bangladesh has a vibrant and entrepreneurial private sector which is well placed to rise to this challenge. Bangladesh faced and overcame the COVID-19 challenge when some doubted us. The country has known climate risks and water security threats. As we have learned to overcome the devastating cyclone storms in the last 50 years, we are confident and committed to provide all our people with safe drinking water. SafePani is one component of our work and commitments to the agenda for action. We will now hear more of the SafePani results from Professor Katrina Charles from the University of Oxford. Thank you.
So thank you, Mr. Ibrahim. As Mr. Ibrahim has highlighted, the government is committing to work with the SafePani pilot to take it up to scale in the Khulna district as part of a results-based contract with a professional service provider. And the government is committing to help fund that, working with the Uptime Catalyst facility as well. So by 2030, the hope is the model will be more consolidated and replicated in other districts and finally be mainstreamed into the government structure. The SafePani, I'll just take a moment to explain more about the SafePani model to you now. So, as I mentioned, in Bangladesh, the MDG was met. There is good access to improved water sources. With the SDG period, that now creates a more complex challenge of trying to deliver services that are also drinking water quality services that are safe, that are reliable, that are affordable, and are based on non-discrimination as well. So the SafePani model works with that, as we see in the diagram on the right. And so some of the key aspects of this are, firstly, that it uses a professional service delivery provider. So an entity with technical expertise who is contracted and accountable to deliver operation and maintenance services, including water quality management. I was in a session earlier talking about healthcare and talking about the difficulties in delivering WASH in healthcare facilities because of the need to train up the capacity, to create the capacity among the workers there. With this approach, the idea is that it's a service provider who has that capacity so that, as was mentioned, those working in education and healthcare can continue with those jobs rather than trying to be the WASH experts as well. The second part of the model I wanted to highlight is it's working in a geographic area. So we have Mr. Osman will talk more about this. We have dedicated service areas where we're working with all government facilities in those areas. And the third point was that one of the key parts of this model is data and transparency, of making sure that data on water quality, on functionality, is reported back to the government and to our steering committee, who have oversight of everything that's going on and have access to that data for their purposes for thinking about policy and finance as well. And so that steering committee includes members of government, not just from the local government department who are here today, but DPHE, Department of Public Health Engineering, and ministries associated with education and healthcare as well. So this model has been developed based on diagnostic work that was done. We've been working with the government in Bangladesh and working on research in Bangladesh since 2016, and research around social, hydroclimatic, environmental, institutional issues in the coastal zone as well as MATLAB. That was used to inform the design, and we've worked closely with the government during the inception processes to agree roles and responsibilities. In the past 15 months, we've been working on a pilot, which Mr. Osman will talk about further, where a service provider has been contracted, and we've delivered that model in 8 unions. And based on those results, we're scaling up to district level. I wanted to take a few minutes to talk about the roles and responsibilities for delivering safer drinking water, because this is one of the key outcomes of the design process, of making sure it was clear what happened with the data. It's not enough to collect water quality data, we need to have actions. And so this has been set out in a brief. There are copies of over there, but I'll just run through it quickly about the three areas of key actions. So firstly, this SafePani model has been developed along the lines of a water safety planning process, but with key roles for the service provider. So the service provider evaluates water safety. This includes sanitary inspections, E. coli testing, and chemistry sampling. The E. coli testing is done through a fit-for-purpose lab that HiSour operate, and chemistry samples are taken to the government laboratories for analysis for things such as arsenic, manganese, and chloride. So if everything is going well and the sanitary inspection is low risk and there's no E. coli detected and the chemistry is fine, that system is considered to have safe drinking water and can continue. If they're not, though, that's when we need action. So the service provider has agreed actions, and these have been agreed from the outset, that this is part of their funding and this is part of their roles and responsibilities. So for sanitary inspections where there are risks identified, they're addressed through repairs and improvements. For E. coli testing, where E. coli is detected, where fecal contamination is detected, these are reported immediately to the local manager of that water system, and then there is treatment, chlorination, and retesting to make sure that control has worked, or if not, further action is taken. The final step for that service provider then is to report that, as I said, to the steering committee. So it's the data transparency is incredibly important, that those results and actions are reported to the steering committee, and it's the steering committee made up of those government partners who is making decisions around actions and responsibilities where additional investment is needed to address water quality concerns and really to act on some of these more substantial challenges we see, for example, from chemistry challenges, so arsenic. I'll now hand over to Osman, who's the Managing Director of Highsour, who's going to share more about how those pilot phases gone.
Thank you, Katrina. I think from all the speakers, you have been hearing the words vulnerability, challenges of Bangladesh. And the map showing on the left side is particularly the southwestern part of Bangladesh. And I should say this part is kind of capital of all vulnerabilities and challenges, because it has all the challenges, all the vulnerabilities that the overall Bangladesh have. So we are particularly working in this region. Another word you have been hearing from the speakers, a service provider. So basically, we are the service provider in this particular SafePani model. So my organization is Highsour. We particularly work for the rural water and sanitation projects under the leadership of our local government division secretary. And we are working in this model for last 1.5 years. So there are about 5,000 unions. So we are piloting only in 8 unions of this particular region. And if you see at the center the number of institutions we are working, in 135 primary schools we are working to ensure safe drinking water. And there are also 35 secondary schools and 33 primary healthcare centers at the rural level. And in these about 200 institutions, we have been so far benefiting nearly 30,000 students with safe drinking water. And in the healthcare facilities, there are outpatients. It's nearly 1,000 outpatients take services from these healthcare centers. So we are also ensuring water safety and safe availability at these health centers. And other than the schools and health centers, we are also supporting 3 community areas who have piped water supply systems. The piped water supply system has different challenges, water quality, tariff collections, many other things. So we are particularly looking after the water safety. And we have been testing, as Katrina was saying, testing for E. coli, testing for chemical parameters. And so many cases have been identified, and instantly we have solved those cases. So regarding the technologies at the bottom of the page, there are 6 types of technologies we have been working in this particular region. The majority is the easy to use deep tube wells, that is the boreholes. And this particular area is not suitable for boreholes. So that's why many of the people in this area are dependent on the rainwater harvesting systems. So we are also supporting rainwater harvesting systems in schools and health centers. There are piped connections as well, as I said, in communities and some schools. There are reverse osmosis plants, which actually remove the saline. And this particular area is also famous for its groundwater salinity. So we are supporting and maintaining these reverse osmosis plants so that it removes all the saline and give the people safe drinking water. There are few areas where some shallow wells are there, and also some desalinization unit based on the solar power systems. So these are the 6 types of technology we are actually working in this southern part of Bangladesh. And on the right side, let's see what we have achieved so far. So all the reported breakdowns, we have been successfully actually managed to repair those within 48 hours of the report. And sanitary inspection that Katrina was mentioning, one of the basic activities we have. We follow WHO checklist for sanitary inspection. So according to the last month report, 98% of the water points we got risk-free, which was 70% at the baseline just a year ago. And water quality, we have been testing E. coli for all the water points, particularly the rainwater harvesting systems. So as soon as we get a report or we get a test result having E. coli, we take immediate actions so that the E. coli are removed. And all the activities, the process, the results, we discuss in two forums. One is the district working group, which is close to the project area and headed by the district administration. And at the central, we sit every 3 months, this steering committee with all the relevant departments, and we also report all our challenges, all our achievements to the steering committee. And the steering committee provide us like the guidance and also decisions on what we have to take in like not regular occurrences. The regular occurrences, there is a strategic protocol, we follow that. But in uncommon cases, we have to go to the steering committee, and the steering committee provide us what to do. So basically, in this approach, we have been working with all the departments of government, education, health, water, everything at the ground level as well as at the central level. And Oxford University is supporting us in technically, also financially. So that is in brief what, as a service provider, HISWA is doing in the ground. Thank you.
Okay, so we've got 2 more slides, and then it's going to be questions and answers. So please be thinking of your questions, and I'll just wrap up this part of the work. You hear me okay? Yep. Okay. So one of the aspects that we are looking at as we sort of try and develop what happens next with this is how much is it going to cost. So this work has been led by Dr. Sonia Hock, who's unable to be with us today, but it's based on a portfolio of surveys and operational and financial data that we've analysed. There's a briefing note here that we can share if you're interested, or it's on the website later, to try and get a sense of what this would cost for the 2,000 facilities that we've mentioned. And as you can read up there, if you can see the screen, it's less than US $1 per person per year. So this gives us a sort of a planning framework in terms of, can we afford to do this, and then how do we set up some sort of sustainable financing model for this? As the Secretary's mentioned, there is interest in results-based contracting for this. So this builds in with other work that we're doing in other geographies in terms of setting these up. And I think the Secretary has explained this very well, that the results, based on the results, a payment is made. So this is a model that is used in a lot of sectors, and one of the things it tries to address is the sort of data verification side. So if you follow the diagram from the left to the right, you may have a funder that's interested in a particular result. So in this case, it is safe drinking water in the schools and healthcare centres. So they can make some funds available for that, to a professional service provider, and Osmond has kindly sort of illustrated the work that they're doing and the types of service agreements they're providing for these schools on water quality and reliability. A key component of this then is to reduce the transaction costs in getting that data back to the payers in a coherent and transparent framework. So this is work that's worked in other countries. So just briefly, Uptime has been doing this work now and has sort of works in 12 countries, issuing contracts for about 4 million people in different geographies in Latin America, Africa, and Asia. So this is the approach that we are planning to apply here to provide this type of simplification of how the model would work. The government of Bangladesh would be one of the results-based funders. The others would be the Uptime Catalyst Facility, which is a pooled fund managed out of the UK. I'm one of the trustees of that fund. And the idea would be that we would run this at the district level up to 2030 and ideally look to expand out to the national scale based on the results that come through it. So I think I will pause there and hand back to Claudia.
Great. Thank you very much, Rob, and to all panelists for the presentation. So we're now moving on to your questions and an open discussion. I see a first hand raised, and I would also like to say that we do encourage questions from women to be taken first. So if there's any female... perfect. Okay. But I've seen all your hands, so we come to it. Thank you. Over to you.
Right now, both India and China, they are in, they are in quick to build lots of dams on the upstream. And what would be the response of Bangladesh? And do you see any possibility of having a river basin organization or some convention or water treaty on Bangladesh with the Tibetans and India and Bangladesh as well? And with the Oxford, do you have any program in Tibet with sanitation and in terms of safe drinking water? Thank you.
Yes, over to you.
Yeah, thank you for your question, but the question is not relevant with today's topic. Actually, we are talking about SafePani in our coastal region, and we don't, get into, the international issue. With India and China, all other countries. So I prefer not to answer to your first question. And the second part, Robert, you can answer whether you have Oxford has any.
Not to my knowledge, but we'd be happy to look and explore if there is any research. So we can maybe talk afterwards. And I'm not aware of it. I don't know whether Katrina is, but we can certainly look into that. Thank you.
Great, thank you very much. I saw a couple of hands raised. Okay, 1 second. Yeah, over to you.
Hi everyone,
Could you stand up, then we can hear you better? Thank you.
The mic doesn't work, so be loud.
Hi everyone, my name is Priyanka Shinde, and just want to say that this is a really great presentation and great program. I wanted to know more about the blended finance bit, and when you say results-based, how do you show those impacts, and how do you ensure that the communities understand this financing bit? So, because as someone who works in rural India, it's very difficult to comprehend blended finance. So, I would love to know more about this.
Yeah, I agree. We're just going to collect a couple of questions and then bundle the response. That will be easier from a time management perspective. So thank you very much. Over to you.
Hi, my name is Razan. I'm the founder and CEO of Hydroco Plus. It's a French-Singaporean water tech company operating namely in India, Bangladesh, SEA, if you will. So under the leadership of Taksime Khan, who's the managing director of the world's largest public water utility, if you will, we started a pilot process back in 2019 where we installed real-time water quality monitoring systems to get an early warning indication of, let's say, the anomalies in drinking water, if you will. Fast forward 2022 and 2023, we've installed over 18 installations of these systems, measuring over 12 plus parameters in real time. We've seen an emerging issue, both in Chittagong Wasa and Dhaka Wasa, which is strilomethanes, a byproduct of chlorinating TOC-DOC, which reaches above 2 milligrams per liter. Now, in the wake of that emerging issue, I wonder, as we transition between rural and urban water supply lines, how can that be also taken into account in the same order of magnitude of seriousness as arsenic, manganese, and so on, if you will? Because this is going to be an issue, as we all know, trilomethanes is a leading issue related to bladder cancer and reproductive health. And this would be an issue not only in Bangladesh, if you will, but other regions as well, if this is the situation we're seeing as an emerging cause. Thank you.
Thank you very much. Okay, I'll take one more question, and then I think we had one over here.
Thank you so much. This is Dr. Imadul Islam, and I'm from Northeastern University doing my postdoctoral research and also working in Japan in the Sasebo Office Foundations. My Honorable Secretary also mentioned that this project very nicely, and government actually taking very good initiative under the leadership of our current Prime Minister. But the problem is actually, that this problem is visible last 50 years, or also the 100 years if we are thinking in our colonial period. So, in this project, you also mentioned some technology that are visible, that are funded by the Netherlands government, like MAR technology and also our own technology called the pond sand filtering. But most of the research proved that this is totally failure in this community. So we are talking about the sustainability and sustainable solutions. So under this project, is there any sustainable technology you are going to introduce? If it is, so what types of technology are going to introduce? So you are talking about some of the community-based solutions that you are trying to introduce some things in school level. So what about their parents? So because water is like that every 30 or 40 minutes we have needed. So, and I'm also the expert in the coastal regions, and and my organization also working in the Bay of Bengal regions with some connectivity in the international level. So, my question is, how long in this coastal area would be the lab for developed country, would be the lab for our university institutions? So, in particular to our Honorable Secretary, is our government and development partner are going to invest some sustainable solutions that are available in developed country? Because water is there. Some need it only for purifications and give to the poor people, those who have only through the pipeline. And some or introduce that he mentioned some technology. So only need for investment, nothing else.
Okay, great.
So my question is, how long we should wait for it? Because our government already rich, because we are going to be a rich country in 2041, and we are talking about the smart. We should be smart. Thank you so much.
Great, thank you very much. Okay, so we've bundled 3 questions. Who would like to address the first one? We had one around blended finance and how local communities can comprehend.
Yeah, I can take that. Priyanka, thank you very much for your question. I think, just to clarify one thing, is we do work in communities, we do work in rural villages in some contexts, but it's not the case in Bangladesh. We are focusing on public facilities, so schools and healthcare centres. So it's a different combination because we're not expecting payment from the user, as you may do with a community-based system. So there's a difference in terms of how you would fund that. So it's trying to be more efficient and effective with public funding going into it. How are you more efficient with that? I mean, the current system at the moment is there would be funds, this is common to many countries around the world, that would go out. So if each of you are a school, you'd each get a little bit of money, and then the government would cross their fingers and hope you all do a really good job with that. But there'll be variability. You'll face different contexts in terms of water qualities, school numbers, whatever it may be, technologies, and you'll get different outcomes. What we're trying to do here is standardize those outcomes. So in terms of the results, I mean, what Katrina's illustrated to us, trying to get some of the microbiological and chemical indicators within agreed government or international limits. So we would be working to those. And then on reliability, what we've found from other work that we've done in Bangladesh, in Matlab, in the east of the country, is often these systems in schools that we worked in there, when they fail, they can fail to be repaired for weeks, if not months, depending on the fault within the system. So then the school children don't have any water, which has all sorts of complications. I mean, there are all the gender inequalities we can understand as a consequence of that. So these are the 2 metrics that we'd largely focus on: the water quality, water safety, and the reliability indicators. And the blended finance side of it is to, I think what the government is proposing to do here is quite unique. There are very few countries, to my knowledge, that is actually looking to put in long-term funding to address the operational point. And this touches upon the question from behind me in terms of, technologies that there's huge investments in the CapEx that goes in, but not the OpEx in the future. And so we get very limited returns from it in terms of the lifespan, which could be 15 or 20 years. You may get 3 or 5 years. And there are, sufficient data for us to understand that. I think in the future, and we do this work in other countries, working with communities is something that we do, and maybe we can have a separate conversation on that. But thank you for your question.
Thank you very much, Rob. So we had 2 more questions, one around the specific water quality challenges that were raised. Katrina, maybe that would be one for you.
So, thanks very much for your question. I'm really interested to hear about your work. I'd love to talk later and learn more as well. For us, with SafePani, we're using a water safety planning approach, and so part of that is thinking about incremental improvement and prioritising the biggest hazards first. So this is why the action on fecal contamination has been prioritised, as that's such a critical risk, and it's one that needs to be addressed, of course, urgently. And so we have achieved that, and that's been brilliant. But certainly we're looking at what are the emerging risks as we go through. So this includes, we're looking at arsenic, which is a very well-established risk. Manganese, while it's well known, the recent revisions to the WHO guidelines change the way we understand that risk. And so that is one which is more of an emerging risk that we're dealing with, and thinking about making sure that the institutions that we're building here to deliver safer water do consider these emerging risks and how you build on new information. Because I think one of the key things for us is to make sure that the data we get to, that we can action. And so I think that's one of the big issues of when we're looking at new water quality threats, is to think about what we do with this action, with this data. Is it just going to be another form of concern for people, or will it be something that we can really make a change on as well? So I think that's the way we're thinking about it. But as I said, I'd love to hear more about what you're doing as well. If I can just pick up too on the sustainable technology that was mentioned to address some of these water quality challenges. Part of the SafePani model is not focusing on the technology. As Mr. Osman has highlighted, we are including all technologies, and so that has included pond sand filter, MAR, I don't think there's pond sand filters in the area, but the MAR systems. But one of the key issues, what we're doing is not changing the technology, but changing the institutions that manage those technologies. So one of the issues with managed aquifer recharge systems in Bangladesh has always been that you need an operator who can manage that service during the wet season when water is plentiful and it's not on people's minds, to make sure that there's good quality water available in the dry season as well. So this is part of what SafePani is trying to do, is to create this shift in institutions so that these water systems are managed for safety, and so that there is management of the water quality systems, there is management of those actions for water quality, to make sure that that is working. That creates a sustainability, and then the technology becomes less of an issue because those institutions are in place to make them work. Would you like to add on to that as well?
Yeah, about the third question that Mr. Imdad has raised, that what the government is doing for sustainable solutions in our coastal areas. Actually, Bangladesh is a very densely populated country and people live everywhere. So in Mr. Osman's presentation, you have seen that he has explained that 6 different technologies are used to provide good quality water to the residents of those remote areas. Moreover, the government is planning to set up a nationwide grid line, because you have seen in map, though it is an ambitious vision, we have 3 big rivers which brings plentiful water from the Himalayas, and it flows over Bangladesh and goes to the Bay of Bengal. If we can capture those waters and we can make water grids all over the country, we can address water crisis in many of our water stressed areas. We are planning for one such grid line in Chittagong area in Miresharai, you may know that Bangabandhu Industrial Park. It's going to be a very big industrial park, and it will, need lot of water, almost 100 MLD per day. And we are planning to have a 140 kilometers long water grid line, which will collect water from the river Meghna, big river, and purify this and deliver to the the industrial zones. So we have plans for, as Mr. Imdad was saying, that as Bangladesh is progressing and going towards prosperity, our plans are also changing. I mean, the government is very eager to give sustainable water solutions to its citizens. Thank you.
Thank you very much, Mr. Ibrahim, also for this insight into the project on water grid lines, which is very interesting. Okay, we're going to the next round of questions. So any further questions, we would take another round. Yes, please.
Thank you for the nice presentation. I just wanted to have a question, because some of these actions are being taken in areas that are very, very cyclone prone, or so in that case, do you have any kind of disaster risk management criteria embedded into this operation protocol of SafePani? Like what happens if after 2 years there is a cyclone in that area, and then some of the actions that has been taken place earlier is now lost? Thank you.
Thank you very much. Further questions? Yes, so first here.
Hi everyone, my name is Amanda. Apologies if you mentioned this, but I was curious how often the water points are tested, and who manages the database, if it was uptime or if the local governments can access it. Thanks.
Thank you very much. Great, one more question.
Hi, thank you so much for the presentation. I was wondering, aside from the water safety and reliability indicators, do you measure other indicators around health or well-being impacts, or do you have plans to do this in the future? Thanks.
Okay, let's maybe address those three. So we had one on cyclone risk and damage to the infrastructure, how this is taken into account. Then one around water point testing, a bit more details. And I think this actually links well to also further well-being indicators being taken into account. So what else is being measured around it? Who would like to address these questions? I don't know, maybe Mr. Osman?
Thank you. I think the SafePani, I think Mr. Imdad was saying, is the SafePani model is actually not investing for any new water sources. So whatever we work, we first assess the existing technologies and about its risk, water quality, etc. Then we do what is doable. Like our sir is changing, is we are not replacing anything. So for example, if in our assessment, if we find that any water point is on disaster risk, then we do something to make it disaster resilient. For example, for the tubules, if there are the low platforms that may inundate during even small flood, then we assess the flood level of that area and we raise the platform so that it doesn't go underwater during flood. So this kind of assessments we make when we go first in any area. So if we see any disaster risks to any water points, then we take note of this and we make a rehabilitation plan. So I'm saying again, we do not do anything new. The SafePani concept is to work with the existings, make them safe and sustainable. And I think second part, maybe some other speaker may cover. Just one thing I want to mention about how often and how data is managed. We have a very dedicated team working in our working area. So central inspection is a very regular work. We have a routine that we have have staff who visits every school in in a frequency, and they collect all this central inspection data. And we have a sampling timeline for chemicals, sampling timeline for bacterial testing. So everything is planned, when to take data samples, when to inspect. And we have a strong reporting mechanism. Like other than our regular visits, the institutions are also informed that if any time they have any breakdown, any water quality issues, they can call us and we immediately go there and see what is the problem and try to resolve it. And for the data management, we are working with the REACH program to develop an online database management system. It is already progressed a lot. So we have almost all the data. Every data is now recorded in an online system. We are now trying to make it more like comprehensive so that in future the uptime facility has a strong dashboard data management system to track the result-based funding or result-based activities. So we'll also transit our systems to the match with the uptime facility, so that in future when the payment will be result-based, then the funders, the government, the steering committee can see what we achieve in every indicators. So that way we are moving forward with our database system.
Thanks, Osman. I can pick up on a few more of those points as well. And I think it's important to point out that because many of these water systems are in schools, they are also the cyclone shelter water system. So they are the water systems that are being used during those events. We haven't, in our pilot phase, had a cyclone to test out some of the responses, but we are very conscious of those risks, and we have put in some, that there are also some actions associated with changes in salinity due to inundation associated with cyclones and flooding that we haven't had to put into place yet, but we do have those approaches as well. On the water point testing, we're currently, with the pilot phase, we've started testing 3 times in a year, basically looking to verify that water quality E. coli is verifying that a water system can provide E. coli-free water throughout the year with that, and looking to reduce that once with scale. But one of the things we're using the data for is to understand more about the variability of these systems and looking at how frequently we need to test the systems for E. coli to understand those risks better. And as Osman has highlighted, there is a dashboard which is available to the government too, so all data are reported to the government. It's not just kept within the results-based funding for uptime. So all that data is available to them. I think the last question I wanted to address too on the health and well-being impacts, we're not tracking those, and that's for the very particular reason that we wouldn't expect to see any, because we are providing services that are for school and healthcare facilities. They would not be providing water that is used around the clock. So we would still expect that students and pupils who are benefiting from this would still be potentially drinking contaminated water at home. So we don't think it is valid to try to test for health and well-being outcomes because of that. It's not providing a intervention that's going to dramatically shift the or totally shift that potential pathogen burden that they're exposed to.
I mean, just a couple of final comments from me on the sort of disaster risk side, which I think is interesting. I mean, the history from Uptime working in 7 countries during COVID over the last 2 years is these service providers can provide high-quality services even in big public health crises. So we will learn as we go on in terms of which facilities or which structures may be more vulnerable, and you can take iterative action. This isn't a homogenous, this is the plan and you never change it. We will learn as we go forward in terms of that work. But what we have learned in Africa during the COVID crisis with Uptime is these service providers can keep on providing services to 96% reliability, even during these sort of, major impacts on social systems. I'd echo the point on the health and well-being. There's been lots of, those who are interested in econometrics and RCTs, randomized controlled trials. It's really difficult to work out these things. I think probably most people would agree providing safe drinking water to schools is a good idea. Do you need more research to sort of actually say, well, what benefits does it is? I mean, who wants to give children unsafe drinking water? I don't think there's much of a constituency for that. So I'm not sure that we would be spending too much time on that one.
If I may, just there's this young lady just behind you. Show me. She's a wash champion, our Bangladesh very own celebrity. She's made it to the Forbes Under 30 cover, if you will. And she's been advocating for WASH for a long time. She'll be speaking also in a UNDP session, but I think she had some questions she wanted to raise. Maybe she got missed, so just give
Thank
her a
you.
plug.
No, thanks for pointing it out. It might be a bit of an angle where I'm not really seeing it. Over to you.
Thank you, Rosie, and that was very sweet of you. Hi, everyone. My name is Shomi, and I'm from Bangladesh, as you mentioned. I'm the co-founder of a global youth-led nonprofit called Awareness 360. And through Awareness 360, what we're basically working on is we actually work with a lot of different schools across Bangladesh as well. We provide them with water supply, building toilets, but we also focus a lot on the awareness component of it. So we focus a lot on the importance of sanitation, hygiene, etc. in order to induce a behavior change. So I'm interested to know about whether you're involving young people or youth-led organizations in this initiative. It seems like a very promising one, and I think that there is great potential in involving youths in rolling this out. So are you already working with any youth-led organization? If not, is there any opportunity to collaborate through organizations like mine? Thank you.
Thank you very much. Okay, taking more questions. Yes, the lady over there first, and then you.
Thank you. My question is regarding the funding. I was wondering whether you have looked at credit carbon as funding. I mean, I have example in Nigeria where indeed they provide access to safe drinking water, and some of the funding are coming from credit carbon.
Thank you. And yes, the lady in green.
Thank you for your presentation. My question is about whether you have plans to sort of extend or apply the SafePani framework to your sewerage and sanitation services in the country, because your testing of the water quality for E. coli implies that you see that there's a system or sort of a deficiency in the system that allows for fecal contamination of drinking water. So I wonder if you would apply the same sort of principles to that service delivery.
Okay. Any more questions? Good. Then we take those three. So one was around collaboration with youth-led organizations as part of the program. Then there was a question around carbon credits as a model to fund this as well, and was a reference to a Nigerian project, and how to expand to other services as well, especially, I understand, sanitation, wastewater services. Who would like to take one question first? Yes, Mr. Ibrahim.
Yeah, let me take the last one, sanitation. Actually, when we saw that SafePani is giving us some very promising results, we are thinking in the ministry that we should have similar model in our sanitation services. And we have seen through a small survey that people are more interested to have good sanitation services than good water services in coastal areas. They want to pay more because sanitation is a type of nuisance. It has some nuisance value. People in our region think that water is a gift from the God, so why should I pay for water? But in cases of sanitation, we have seen that they are eager to pay because it has some nuisance values. So it is in our thinking that we should start something like safe sanitation or any program following SafePani in future. Thank you.
Thank you very much.
Yeah, I can take a couple of questions. The carbon credits, I think it's an interesting one. Obviously, the assumption, as you know better than me probably, is that people are using firewood to clean the water. all the academic evidence that I've seen is less than 5% of people actually boil water for drinking. So there's a basic problem with it. I mean, it's great to have carbon finance. We would love carbon finance, but the actual logical foundation of how it works is slightly flawed, in my opinion. But maybe we can talk about that afterwards. And then involving youth, I mean, I think that would be interesting. It's not the case at the moment. I mean, thank you for your question. Congratulations on your organisation and the work that you're doing, which is brilliant. It's certainly something that we could consider, and maybe you could give us some advice in terms of what we might do. We have done work in Kenya in the past where we've brought some of this work into schools as part of the education curriculum. So Johannes, who's there, has worked with me in Kenya where we've done some of this work, and maybe we can mention that to you. But perhaps we speak afterwards. At the moment, the answer is no, but that's not that we couldn't consider it in the future.
Appreciate that.
Okay, thank you.
Great. All right, more questions in the room. I'll try to look around.
Yeah, I mean, we can wrap up. I mean, thank you all for your engagement today and all the questions. There's clearly a lot of follow-up that we can pick up, and we're available after this event to look at that. If people are interested in tracking the progress of SafePani, we'll try and put all the materials are currently uploaded on this website, and we'll keep it available going forward. We'd like to thank very much the government of Bangladesh, Mr. Ibrahim, Mr. Kirul Islam, and Mr. Kamal for joining us today. It's a long way from Bangladesh to New York, so we're very appreciative of you coming here and the collaboration through this work, and for the commitments made today to try and advance this work to 2030. It's very much appreciated going forward. We thank you all for attending. Happy to speak to you afterwards as you're available, and we wish you a very happy World Water Day and a successful conference. Thank you very much. Thank you.